Hi, I'm Dr. Dan Lieberman. I'm a psychiatrist, a clinical professor of psychiatry, and the SVP of Mental Health at Hims and Hers. Lexapro is the brand name of an antidepressant that contains escitalopram. It's an SSRI, a serotonin-specific reuptake inhibitor, that's effective for both depression and anxiety. Lexapro works by increasing the activity of a brain chemical called serotonin. Serotonin is a neurotransmitter that's involved in a lot of biological processes, such as controlling sleep, appetite, and in this case, most importantly, depression and anxiety. The brain is composed of billions of individual cells called neurons, and they're in constant communication with one another. They use both electricity and chemicals, neurotransmitters, to bring about this communication. When two brain cells are communicating, they're very close to one another, separated by a tiny fluid-filled gap called a synapse. The cell that's sending the message releases neurotransmitter into the synapse. It floats across to the cell receiving the message and binds to a receptor on the postsynaptic cell. This leads to a cascade of chemical reactions in the cell receiving the message, and that changes its behavior and eventually leads to the resolution of symptoms of depression and anxiety. For depression, the usual starting dose is 10 milligrams. For anxiety, it's a bit lower at 5 milligrams. The maximum dose of this medication is 20 milligrams. When people first start taking Lexapro, sometimes they experience a few days of nausea, maybe headache, maybe sleep disturbance, but these tend to be pretty mild and they go away after 2 or 3 days. Now, with all SSRIs, about half the people who take them can get sexual side effects. This is decreased interest in sex and difficulty reaching climax. If that happens, it's very important to discuss it with any sexual partners you might be active with. There are other side effects that are a little bit less common, but the important thing is that if you get any side effects at all with Lexapro, talk to your provider. In many cases, the side effects can be managed. In some cases, eliminated completely. All antidepressants, Lexapro included, are required by the FDA to have a black box warning. The reason is that during clinical trials, there seem to be some signals suggesting that among young people, age 25 or younger, there might be some increased suicidality. There was no evidence of this happening in people who were over the age of 25. Now, it's controversial. Some people think that this was just the result of an improper statistical analysis. The bottom line is that depression causes suicidality, and the best way to save lives is to treat depression. If you're taking Lexapro or any other antidepressant and you do experience suicidal thoughts, the most important thing is to talk to your provider. It's a difficult question. The problem is we just don't have a lot of data because scientists don't like giving pregnant women drugs to see if it's going to harm their fetus. The bottom line, though, is that I and most psychiatrists recommend that if a woman is doing well on an antidepressant, she should continue to take it throughout her pregnancy. There are definitely risks. There doesn't seem to be a big risk of major congenital malformations, but there can be some risks around delivery and after that. The important thing, though, is that untreated depression also causes risk to the fetus. And so it's important to maintain a healthy mother in order to have a healthy baby. It's important to make sure that you coordinate your care with your OBGYN so that everybody's in agreement, everybody's on the same page. Thanks so much for watching. If you have other questions about Lexapro or other mental health issues, leave a comment and I'll try to answer it. And don't forget to subscribe so you don't miss a single episode about mental health and how to feel your best.